There are two reasons why patients hold back from treatment. One, obviously, is finances, and two is fear. So we could try to remove those things out of the way. I think we would achieve much better, much more efficient results. The fear specifically is a real problem. Nobody really likes to go to the dentist. But the truly fearful patients, they will try to postpone the visit until they cannot withstand the pain anymore. So when they come here, the problem is about this big. Now we need to do procedures that are way more invasive, way more painful, truly. And it kind of reinforces them. It's like, you see, every time I go to the dentist, it's just horrible.
Welcome to the SN Podcast Dental Series, where we sit down with dental practice owners and DSO leaders who are building or modernizing their practices in interesting ways. I am Geet, founder of AISN Partners, where we help healthcare and wellness practices to generate leads, gain operational efficiency, and become easier to find and bring efficiency with automated solutions. Today, I'm sitting with Dr. Anna Hoffman of Pennington Family Dentistry, a practice that has been serving Mercer County, New Jersey since 1962. Dr. Anna brings something you don't see every day, a dental degree alongside a master's and PhD in biochemistry. And she's carrying family legacy forward along with her husband, Dr. Bernard. Dr. Anna, welcome.
Thank you so much. Thank you for having me here today.
So, Dr. Anna, Pennington Family Dentistry traces back to 1962 when your father-in-law founded the practice. Take us through that journey. How did it come to where it is today with you and Dr. Bernard now running it together?
So my father-in-law started this practice in Ewing in 1962, and then they moved in here, the current location that we have, in 1980, started practice dentistry. And over the years, my husband saw the way the lifestyle, the way my father-in-law care for the patients, and how nice it is it's a farm. So he liked the combination of having a farm right here in the middle of Mercer County and have a high successful practice. And that's what led him to go into pursue dentistry. And years later we met. I was already a dentist. I had to get recertified here in this country. And then we joined together, and that's where we are today.
So it's interesting. So you're living in a farm away from the hustle bustle of the city, right?
Correct. So Pennington is a small community. We serve Pennington, Ewing, Hopewell, Princeton, but it's not anywhere near like big cities like New York City or the city that I was from, Brazil. So it's a nice and calm pace that we just,
So you like being there?
I love it.
Okay, I'm sure. And weather and everything, it would be like a good greenery weather every time you look around.
It doesn't go a single day in the practice because the office, each operatory has a large window facing the back of the property. So it's like an enormous field. So there's not a single day that goes by that patients look and it's like, oh, this view is just so beautiful, peaceful, They're anxious, they are nervous, they are, hesitant about dental treatment. And the majority of the traditional everyday dental office, you go in and you're in the tiny little.
Yes, so this will give them a soothing feel as well and, change their mindset altogether.
Correct. The really nice ones might offer you a TV to watch, but
Yes.
ours, we see nature.
Yes, that's a great, view. So you mentioned that like patients have been with the practice for decades. What do you think keep that kind of loyalty alive across generations?
Patients feel the connection. On top of that, we have our name on it. My father-in-law started this, and the legacy is really important. So the patients come here with us, they know that this is way more than just a business for us. It's very personal. We treat the patients the way we wanted us to be treated. And, Majority of the time, we will see, look, in the long term, this is the best result for you. So that's what you should go for. So
Mm.
they trust our judgment, they trust our clinical skills.
That's fantastic. And your twins are now, 14, and your daughter has shown some interest in following the same path. What would it mean to you if the practice became a third generation story with that?
Very special. It's not every day that, father and son or father and daughter, mother and daughter can connect in this pathway. And to have my father in law, so it's already three people in the same family, right? And now if we get another one all by herself, it's not that we are pushing them or anything. Since very young age, she used to like to go in there and say, Mom, can I call? What's the name of the next patient? Can I call her? So she would go there, and the patients love that interaction too. Some
Mm,
they say, I remember when your husband used to do that to me. Now your daughter, you know, it's very special.
it feels special. And you mentioned that, you started dental school in Brazil at a very young age. And then what was it like stepping into this, that role so early in your career?
So very special also because I love dentistry. Different than my husband, I didn't have dentistry in my family. Most of my family members were physicians. So I knew I wanted to be a healthcare professional, but somehow I was tending more towards dentistry rather than medicine. But dentistry in Brazil, unfortunately, still can be very challenging because of financial difficulties from patients. So when I had the possibility to come here and practice with my husband, it's a complete different. I feel that we can do a lot more to the patients.
Mm. You can give much more to the society, patients, and
Yes.
carry
That's
forward what you have built. And you also mentioned that dentistry gave you freedom to build a career around family life in a way that medicine might not have. Looking back now, how has that decision shaped the life that you have built so far?
I definitely think I did the right option. Medicine is a lot of the specialties. It really takes a whole new level of commitment. You have to do on calls, you have to be in hospital, it's a true dedication profession. And the part that really made a difference to me was that I always like this human connection. I like to and what do they do, what are their kids doing, where they're going, vacation, whatnot. And unfortunately for medicine, there's a lot of different specialties that you end up losing patients because a medical condition that will kill them. And that the patient usually is either because they moved or they change insurance, something like that. So the connection can be much longer. Not everybody has their own cardiologist or rheumatologist or like when you go to a medical office, except with a primary care physician, you usually go to that office because you already know you're having a problem. You're trying to search for a solution as
Mm.
opposed to it's really part of your routine. You have to have your cleanings, so the prevention portion of it much.
So emotional connection is better and there is less setback as compared to what you have in medicine.
We can still have the hours in the office and our kids have a game or a play or whatever they have to do. We can always try to rearrange the
Mm.
schedule,
That time for the kids and the family
stage.
without compromising for the patients as well.
Correct.
Mm. Mm. And today, the practice handles a large majority of procedures in house between you and Dr. Burnett. What
Correct.
made you both decide to build that kind of range rather than referring more out?
I always tell patients that biology is not math, so you can interpret things different ways. And when you start having several different doctors, you can say, like, oh, you have to do this. They might have different opinions, or they don't know the patient and they say, oh, you shouldn't have to do this, you should do that. And sometimes it can create not only confusion, but also insecurity to the patient. If
Mhm.
you have a very nice, clear communication with the other professions. So
Mhm.
trying to do that all in house, the patient will be more confident that they
Mhm.
are going to be treated by me or my husband, and they trust us and they agree with our
Judgment as well.
yes.
Yeah. Then they don't need to go here for one thing, there for another thing. They know that everything they will have it here.
We installed a CT scanner in our office about, I think, 3, maybe 4 years ago.
Mhm.
And before that, my husband has been placing implants for over 10 years now. Patient would come here, we would diagnose that patient needs an implant. We would give them a prescription to go have a CT scan when they
Mhm.
leave their hygiene procedure, right? Life happens, things happen, we kind of forget about to follow up. Now
Mhm.
months later, patient is again in another appointment for another cleaning, and we're like, "Oh, where is your CT scan?" "Oh, doctor, I never did it." So now when patient needs an implant and they truly are interested and committed to moving forward with the treatment, we say, "Okay, we can do the CT scan right now for you in 5 minutes if you have enough bone, or how do we need to proceed to achieve your treatment plan goal."
Streamlined process now makes it easy for the patient also. He doesn't need to go anywhere else. So apart from CT scan, what are the things that you do now in house that you were not doing previously?
We have an iTero scanner already for over 10 years.
Mhm.
The I think the third model that we have. We are currently considering getting a 3D printer and start
Mhm.
in-house lab work, because the lab work still obviously we submit to the lab,
Mhm.
have crowns done, and sometimes, temporaries and whatever needs to be done. And we believe that now we are starting to see the type of quality that just a short 2, 3 years ago we didn't have it.
That'll be great for you. And you and Dr. Bernard have split focus areas. He is on implants and restorative work, and you on Invisalign and occlusions, and now sleep dentistry. How did that natural division come out, and would you want to talk about that more?
So I don't like surgery. Never did. He really likes. He's really good at it. So I'm like, really?
That, see, that's how husband wife pairs sometimes work so well. You're contrasting opposite.
At the beginning of my career into the office, I would look at the x-ray and I'll say, well, that extraction looks pretty easy. I'll do it. And then, half an hour later, I'm still like, now I'm sweating, patient's getting nervous, and things like that. I'm like, call him, I need some help. And then he would come and like, doing this. Why am I suffering? Why is the pain? No, let's get patient needs extractions, implants, whatever it is that is surgical, it goes to him. I know that he is great. He will do it fast and efficiently. And then he actually started doing orthodontics when he first graduated, and he really didn't like it. And when I got involved with Invisalign, I loved it. That's some of my passions, like how to change somebody's occlusion. You can improve their smile just by realigning their teeth. And I think that from there, it was almost like a gradual expected transition to seeing like we are aligning teeth. We are also seeing how patients can breathe better, can sleep better, like all of that connection with mouth and body that now we are moving towards.
So
So
Teeth alignment can affect sleep as well. That's interesting.
The teeth alignment can affect not only the sleep, the mostly the breathing. What most people don't think about it is that your palate, the roof of your mouth, is also the floor of your nose. So when
Mhm.
you have a very narrow arch,
Mm,
your nose, preventing air to pass. Once you expand the arch and make things more spacious for the teeth, you also put that roof of your mouth
mm.
on a lower position. So you open your nostrils, you open your airways.
Wow.
That, like, your tongue can move forward. It's a whole physiologic process. It's fascinating.
Sounds interesting as well. And sometimes these are small things you don't know. And when someone tells you it, they feel like, yeah, it makes sense. You are definitely very passionate about it. And that's the specialist work that you really enjoy.
Do I really do?
Good. So, and you're still in network with several insurer at a time where local competitors have moved away from that model. What's guided that decision?
We are still trying to be able to continue to serve our patients and our community the best we can. And obviously, financial difficulties is always one of the top reasons why patients don't follow through treatment. So, as long as we can still continue to maintain our quality work, keeping an alternative, more affordable option for patients, we will always try to do that. We developed a discount plan in-house. We do have a lot of Brazilian patients that come to see me. We have other patients that retired, they lost their insurance, things like that. So we try to offer those patients these options to try to eliminate the financial barrier and say, what can I do to help you achieve your health goals in a world where finances would not be a problem.
Hmm. That sounds like a very good approach and something that you could do when you really are, it's very personal for you. Hmm.
Yes.
So, as you think about the next chapter for the practice, is there a particular area of growth you're most focused on right now, like patient volume, a specific treatment area, expansion, something else? I think one you mentioned that 3D printer is something that is on the card, but what else is that you're focused on right now?
So, as you said, I think the focus that we try to keep, my husband really likes his part surgical portion. I really am trying to focus a lot more on Invisalign and sleep dentistry and how we can improve patients' lives through those tests. Always keeping in mind that, maintaining hygiene and keeping health, that's all, that's our daily routine.
Hmm. And you're starting with the sleep dentistry and sleep appliances recently, right?
Correct.
And what drew you to that on the focus and what are you seeing so far?
Well, once I started getting a lot more involved with Invisalign, one of the faculty members was very interested in sleep and breathing and sleep disorder breathing and all of those things. So the more I started watching his lectures, the more I realized that it's like, wow, that really, it makes sense. Oh my God,
Mm. They
I
connected. Mm.
have patients that do that. And that what really drove me towards this is something that I will absolutely impact positively the lives of our patients, because once the patient breathes better and sleeps better, everything else gets better in their life. And I think that more and more patients are recognizing the mouth body connection, which sounds so, of course, your mouth is part of your body. How can it does not have a connection? Somehow, for years, nobody thought that your dental problems would impact your overall health.
Sleeping pattern or anything else.
Yes.
Yeah, that's an interesting. area, to explore further and see what's in there. So what do you have vision for your practice for next, 12 months, I would say? Where do you want to be?
12 months? Yeah, I think the 3D printing is something that I believe my husband and I should start pursuing into it. I believe that we believe that now we reach a point where technology reach the level of the in-house and the lab thing is has been matched.
Okay.
Opposed to before, we would have like a milling machine or something that you can do in-house, but that one versus the one done in the lab still had a gap. And I that now we are reaching the level where we can already we reach the gap. Yes.
And what do you do with the 3D printer when you have it?
So with the 3D print, we can do onlays, we can do full crowns, we can do mouth guards, not necessarily sleep appliances yet, but just regular night guards, sports guards. Our
Mm.
son
So
plays
you
sport.
can print all of these in house and then implant it, right? That's how it will be.
Yes.
Okay. Yeah, that will be cool.
Yes.
Sounds like you've had an incredible journey so far and there is a lot to do further. Hypothetically, if you had a magic wand and you could fix one thing in your business right now, something that's holding you back or slowing your progress, what would that be?
That's an interesting question. I think if I had a magic wand, can I have two?
Yes, sure. Three, you can have three if you want.
So I think that are two reasons why patients hold back from treatment. One obviously is finances, and two is fear. So
Mhm.
we could try to remove those things out of the way. I think we would achieve much better, much more efficient results. The fear specifically is a real problem. Patients, nobody really likes to go to the dentist. We understand, but the truly fearful patients, they will try to postpone the visit until they cannot withstand the pain anymore. So when they come here, the problem is about this big.
Mm.
So now we need to do procedures that are way more invasive, way more painful, truly. And it kind of reinforces them. It's like, you see, every time I go to the dentist, it's just horrible. And what
Mm.
I try to show them is that it's horrible because you didn't come earlier. If you
Mm.
always try to be preventive and follow up with your 6 months or even 3 months, sometimes you need to have the follow through and try to overcome your fear. Each time that we will take care of you, we will intercept the potential problem when it's really this big, and then it's not a big deal. And then eventually they will withdraw from their fear and become a more committed patient.
Hmm. So, like when they don't take it like a preventive care, that's where the problems start getting bigger. But how do you think you can address that fear component if someone is having something like that?
Really hard. We need to have the patient here first. And what I always try to tell patients, especially when they come as a new patient and you look in practically their entire mouth, there's something that needs to be done, they get really overwhelmed. And I look at
Mm.
it, look, we didn't arrive here overnight. So we're not going to go from where we are to health overnight either. It will take a journey. Okay.
Mhm.
But if you are willing to go through the process, we will try to help you all the way. And
Mm.
then the more important part, keep it. Because some of them will even go through the whole cycle all over again,
Mm.
just
Mm.
now maintain the work that we did.
Hmm. And so, yeah, that's something psychological actually. It's very different to fix it. And then How do you think you can address the financial barrier part? You're already offering to help them overcome that barrier, right?
So obviously being in network with the insurance is
Mm,
already a
help.
huge help because even when they max out their benefits, we still follow the fees. That's obviously a huge
Mm,
help.
right.
The other portion is we do also have for treatments that are longer, like Invisalign, implant placement, things that will take longer from start to finish. We do offer payment plans in-house that
Mm,
are free. And
mm,
ultimately for patients that really even within that space, the the monthly fees are still too much for them for their budget. We also do offer third party financing.
mm.
That one will have some interest and will depend on their credit. And it's a third party company, but we try to offer that as well to once again eliminate the
That financial barrier, yeah, and help them out. So basically, you're trying everything at your power to really
on our
help
end,
them out.
try to improve and help them. We put the ball back on their field.
And what we see now is that patients are increasingly researching details for any practice owners, dentists before even calling the office, sometimes even asking, AI tools like ChatGPT as well. Have you noticed that shift and how is it changing the way people find you? Or because you're living in a small town, it really doesn't affect you as of now?
So we do have some patients that come as new patients become from searches,
Mm,
on searches, whether if it's AI, whether if it's the traditional Google search. I
mm,
We still have quite a bit of patients that search through reviews. Once
mm,
once they search, what are the dentists near me? They will get their two, three top names. And then from there, they're going to go and then they will see how many reviews, so how many good reviews, things like that, obviously. So that has been going on for a while. For our specific practice, we're very fortunate because we still rely a lot in word of mouth and get a lot of patient referrals. So that's still golden because, you will probably trust a lot more your best friend or your neighbor, somebody that you know that already went to a place and it's like, go to that person. They are really good, as opposed to,
right.
online searches, whether if they, because a lot of times they can be paid for and not necessarily translate exactly what the patient goal is.
Exactly. And, doctor and treatments are something like that. That's something very personal as well as something that you want to choose very carefully. So, looking ahead 5 to 10 years, what do you hope Pennington Family Dentistry look like, and what would you want a third generation, if it happens, to inherit from what you have built so far?
We are in a very good place. We have reliant staff. It sounds cheesy when we keep repeating, but we truly treat them like family. Our manager can come here and see our kids for a day or two. And so in 10 years, I want to continue to have that. Hopefully, we will increase a little more on the sleep dentistry, a little more, try to help patients on the more overall health field portion. Maybe my husband will be doing more implants and same day dentistry with the 3D printing. And if our daughter truly goes through the path of dentistry as she's claiming currently that she plans on doing, I really just want her to inherit the same office that we inherit from my father-in-law, a very family oriented, very trustworthy environment where the patients come here and they believe our judgment that we are truly planning for their best. Rest.
Mm. Mhm. So I hope everything's worked out how you've visioned it for, and everything regarding the sleep and the overall health. That's the next chapter that you bring on to your dentistry. So this has been
Okay.
wonderful, Dr. Anna. And thank you for sharing your story. You're carrying this legacy forward the way you have. I am Geet, founder of AIS and Partners, where we help healthcare and wellness practices to generate leads, gain operational efficiency, and become easier to find, especially now that more patients start their search with AI tools instead of Google, and bring efficiency with automated solutions.